Niacin, also known as vitamin B3, has long held a reputation as a cardiovascular ally, particularly for its ability to lower LDL, bad cholesterol, raise HDL, good cholesterol, and reduce triglycerides. For decades, it seemed like a logical add-on therapy for patients at risk of heart attack and stroke. But something strange happened when researchers looked closer. In several large-scale clinical trials, niacin improved cholesterol numbers but didn't improve outcomes, and in some cases, it was even associated with a slightly increased risk of stroke. Cue the scientific head-scratching. How could a vitamin so deeply intertwined with lipid health backfire when it mattered most? To untangle this paradox, we have to look beyond cholesterol and into the metabolic fate of niacin inside the body, specifically how its breakdown products may impact cerebrovascular inflammation, endothelial health, and immune signaling in the brain. When you take high doses of niacin, especially in its nicotinic acid or nicotinamide forms, the body doesn't just use what it needs and toss out the rest. Instead, it works overtime to metabolize the excess, especially through the liver. This is where the methylation pathway comes into play, converting niacin to metabolites like N-methylnicotinamide, MNA, and further to N-methyl, 2-pyridone, 5-carboxamide for PY. While these metabolites were once thought to be harmless waste products, research increasingly suggests they are biologically active and not always in good ways. In particular, PY has been implicated in promoting endothelial cell activation, the very process that primes blood vessels for inflammation and immune cell adhesion. This happens through upregulation of molecules like VCM1 and ICM1, which act like sticky name tags that recruit white blood cells to the vascular wall. That's bad news in general, but it's especially bad for the fragile and tightly regulated vessels of the brain, where inflammation can compromise the blood-brain barrier and disrupt normal blood flow. And when cerebral vessels are inflamed or narrowed, the risk of ischemic stroke, when blood flow to a part of the brain is blocked, increases. Beyond endothelial inflammation, niacin's effects on platelet activation may also play a role. Some studies suggest that niacin, or more likely its metabolites, can enhance platelet aggregation under certain conditions. This increases the risk of clot formation, again posing a danger to the brain's vascular network. A tiny clot in a small cerebral artery can cause disproportionately large damage, especially if it hits a region responsible for motor control or language. Unlike the heart, which has some redundancy in blood supply, the brain plays no games. One clogged capillary and the lights go out fast. There's also growing evidence that niacin metabolites may interact with purinergic receptors and macrophage signaling pathways, fancy words for saying they can tinker with immune cell behavior and inflammation in the central nervous system. While the exact pathways remain under investigation, the theory goes like this. High-dose niacin leads to excess 4-PY and related compounds, which in turn stimulate low-grade inflammation in cerebral vessels, set the stage for atherogenesis, and possibly make the brain more vulnerable to both clots and hemorrhages. Let's not forget that many of these niacin trials involved already at-risk patients, such as those with metabolic syndrome, diabetes, or a history of cardiovascular disease. In these individuals, endothelial function is already compromised, and the blood-brain barrier may be more permeable than ideal. Adding a compound that further irritates the vascular lining, especially at doses far beyond what the body evolved to handle, can push a delicate system over the edge. For example, in the AAM-HI trial, patients taking extended-release niacin showed no cardiovascular benefit despite better lipid profiles, and there was a non-significant but noticeable uptick in stroke risk. Similarly, in the HBS2 THRIVE trial, niacin combined with laropiprant to reduce flushing led to increased adverse events, including bleeding, infections, and, again, more strokes. These findings spooked researchers enough to question whether niacin's time as a cholesterol-lowering mainstay was over. Spoiler, it mostly is. This doesn't mean niacin is inherently dangerous. It's still an essential nutrient. Deficiency causes pellagra, a nasty condition involving dermatitis, diarrhea, and dementia. But the gap between deficiency and pharmacological dosing is enormous, and that gap is where risk emerges. When consumed in amounts several times higher than the body needs, niacin is no longer just a vitamin. It becomes a modulator of gene expression, immune signaling, and vascular tone. And while that can be beneficial in tightly controlled contexts, it can also backfire. especially in the intricate, high-stakes environment of the cerebrovascular system. So, if you're considering high-dose niacin because you heard it's good for your heart, remember, cholesterol is only part of the picture, and there's more to vascular health than HDL levels. It might be better to get your niacin from salmon, mushrooms, or whole grains, foods that come with context, cofactors, and natural limits, rather than surprise inflammation and brain vessel drama. And as a general rule of thumb, if a supplement burns your face when you take it, yes, we're looking at you. Niacin flush. Your body is probably trying to send a very clear message. One that translates loosely to, easy there, superhero.